In this video, let's talk about hip pain at the back of buttock. Hi, this is Wei, your exercise physiologist, here to help you better understand your body so that you can improve in your health, fitness, and performance. So, very common, people talk about hip pain, and most people only mention about the hip pain that's happening at the front of the hip. And whenever we talk about the hip, most people are only, it's a very general intuition. People will think that it's actually the front. And so if you talk about the hip, we need to look at it in like a 3D dimension. And in this video, we're just gonna focus on the back. And if you haven't watched my previous video, I actually have a hip tour, a hip anatomy. So if you haven't watched it, you can click on the link over here. So as for this video, I wanted to make use of this 3D model, this software that I've been using, so that you have a better understanding what are the muscles that's involved, what can cause the pain at the back. Alright, so let's begin. So here's the anatomy of the hip. Let's just focus on the back, right? In this video, we're really going to focus on the back. And let's also start from the deepest layer, which is this, right? Your bones, your ligaments. So this yellowish thing that you see over here is basically your sciatic nerve, right? Every time when you feel some pain, the nerves are definitely involved, because the nerve's job is to pick up whatever is wrong, especially if you talk about pain, and it's gonna send the signal back to your brain. So if I were to remove the skeleton, this is what the nervous system looks like. So if there's anything wrong with the buttock, something will be picked up, the signal will be sent all the way back to the brain. It happens to any part. It can be your upper body, it can be your limbs, right? It can be the lower leg, right? So that's really what the nervous system does, right? Picking up signal and sending up to the brain. You can actually search even Wikipedia that that's one of the nervous system's function, right? So if you have something that is radiating, then again the nerve is involved, but this time around it's slightly different. The way it's involved is that there may be compression on the nerve, and it's giving the body some kind of weird sensation, something is happening over here. And that's why some people feel radiation, tingling, pins and needles, shooting pain, somewhere along this line, right? So these are the things when we talk about nerve compression, and that's how you can get yourself into all this kind of symptoms, right? So if we are talking about just the hip area, let's not go everywhere, right? Structural wise, of course, there'll be your bones, there'll be your ligaments, we clip the nerve, and of course your muscles, but we're going to talk about it later, right? If there's any tear or there's any damage to your ligaments, to your bones, these are the really main ones over here, around your lower back, your buttock. Now you need to ask yourself what had happened, because for a bone or a ligament to break, to fracture, to tear, it's not that easy. You have to get into some sort of accident that is of high force, high velocity, so huge that it can break your bone or tear your ligaments, right? So that's basically what you need to know about if bones are, getting involved, ligaments are getting involved, and if you know that it's in a very localized area, which is at the back, right? So in terms of those muscles at the back, there are actually a number of them, right? So the deepest layer that you can see over here, most of the time, if you feel that it's coming from this muscle, which is really not easy to strain, it's basically under the buttock. So it's really at the start of where your thigh bone is, where your leg is. It's not even in the buttock region, right? So let me bring in the buttock. You will feel somewhere like lower region here. Okay, so well, if you are very specific, I wouldn't call this area like the buttock. Okay, this is already beyond the buttock, but whatever it's on top, it's still the buttock. Okay, so let's go back in again, and you can see that the rest of the muscles that's coming in here are your piriformis muscle. I group them together because most of the time, all of them will get into, sorry, the piriformis is coming in next. This is the one. And I usually group them together because you can't say that, oh, definitely this is the muscle that you get strained. Definitely this is the muscle that you get strained. It's almost not possible. So far, over the years that I've practiced, when somebody told me that, you know, it's deep inside and they can feel it, this group of muscles just can't run away. And I usually, you know, tell them to stretch it out and to find out that what's usually the problem. And later on, they will have to be going through some form of strengthening exercise, right? So these are your piriformis group muscle, and that's what I usually call it, okay? And some people really can get this guy working a lot, right? Okay, just to put it more general, because knowing patients, this region, let's call it the buttock area. Okay, because now that I'm doing this video, there are some cases where, because the origin of the hamstrings, it's over here, people do feel some pain around this area. And they're not wrong to say that it's the back of the buttock. More precisely, it's the origin of your hamstring muscle, part of the hamstring muscles, right? Basically, there are different hamstring muscles over here. This one that you see is basically your semimembranosus. The other one that is very close to it is actually your semitendinosus, which is this guy that just came in here, okay? And because they're so close to each other, right, they're just lying on top of each other, basically, okay? So again, you see that it's over here at this region, right? And if you are so good, you won't be watching this video anymore. You basically know what's happening. So I don't want to exclude this. I want to include this because this can be one of those things that's actually causing some pain around the back of the buttock. Okay, basically also your hip. Right, so moving on, another one, still your hamstring muscle. As you can see, this is another guy that's running this way. It also starts and originate over here. So basically, if you talk about hamstrings, all of them originate like just side by side, as you can see. Okay, of course, it requires a lot more testing to understand whether, you know, exactly which one is giving you the pain, if it's really coming from the hamstring. Okay, so let's move up. We covered the piriformis group muscle. The other ones that haven't been mentioned is basically your glutes medius. In my previous video, like I said, I call this the little brother or the third brother. Okay, so he is that guy that it's more onto the side, but as you can see, part of it is still at the back. Okay, so that's your third brother, and then we have your second brother, the glutes medius. All right, so the glutes medius and the glutes minimus, they work very closely with one another, or you can tell that basically they are just coming from the back, the side, and then it's going to the side of the hip, right? Most of the time, people mention them as a adductor. Okay, so basically it's the movements that you're actually moving out. Okay, so basically that's what we call the adductor, and they are one of those muscles that's mainly doing the job. But again, you can say that they are not at the back of the buttock. Alright, so the last guy is basically our big brother, and his name is the Maximus. Okay, so this big brother most of the time should be doing the work for most of your hip extension related. But in recent years, I've realized that a lot of patients' glute max, rather the big brother, hasn't been working for the longest time. It's weak and it's not functioning well, and that's why without, and you can see the size of the muscle, it's pretty big. It's one of those things that should be the powerhouse over here, but because it doesn't work, the smaller ones, second brother, third brother, I usually call them the cousin. Okay, they don't run the same name. Piriformis group, I call them the cousin. Okay, and maybe you can call this the distance cousin. All right, so they may be affected just because some weakness is happening. Of course, this doesn't apply to everybody. It's just one of those possibilities. Okay, so first thing, you need to find out what exactly is giving you some problem, some pain over here at the back of the buttock. If you have been, stretching, if you have been using heat pack, if you have been rolling it and all this, it will feel better. But if it keeps coming back again, then, like I said, you need to get to the root of the problem, because you may be compensating it due to some weakness that's happening here. So these are the muscles that's probably giving you the problem, and you may want to take a better look, or have somebody look at it, because it's really hard to find out yourself. Okay, so find a professional, get it sorted out. So as you have seen, there are actually different muscles around the hip area, the hip joint, and whenever you feel the pain that's around the area, the easiest way, of course, if it's a muscle issue, is to massage, is to use the heat pack, it's to stretch it out. But if you get this kind of pain, aches, and soreness over and over again, you may need to think about what is causing you the pain, because that's really the main thing, and you want to get to the root of it. Managing it using massage, trigger ball and all this is just a make do. Of course, you can do that to help yourself, but if there's already some weakness that's going on, then it doesn't help, especially if you are going towards the performance side of stuff, right? In terms of health, in terms of fitness, most people still can bear with it, but that's not what I recommend as well. So getting to the root of the problem still is the main, I would say, the best way to treat a problem, because like in any pain or any sore and any aches, you can always use painkillers, you can always take medicine, you can always use any patch to help you ease the pain. Like I said, it doesn't solve the problem, right? So if I were to give another example, you have a kid at home, right? You handed this kid a marker, and every time your kid will be drawing on the wall, right? So what's the issue here? Is it because the wall is dirty, or is it because someone else dirtied the wall? You can always clean the wall, no problem. You can get the best cleaner to clean the wall. 2 days later, your kid will return and draw the wall again. So where's the problem now? Is it still the wall, or is it the kid? Do you want to stop the kid from drawing on the wall, or are you going to continuously clean the wall? This is the best example I can think of right now at this moment, but I hope you get the point, right? So get to the root, solve the problem, and you'll all be good. That's all I have for you today in this video. Please don't forget to subscribe, to like, and to hit the bell. If you have any questions, do drop it at the comment section below. And it doesn't have to be just related to hip issue. It can be other joints or other problems that you may have. And if everybody is asking something similar, I can then create a video or just talk about it. And so that helps everybody. Right? So please take care, and I will see you soon. Bye-bye.